Every 40 seconds, someone in the world takes their own life, but suicide is preventable. In our series, Wear the Gown with UT Physicians, a reminder that there is always help and there's always hope. Along with the physical sickness and public health crisis due to the coronavirus, psychiatrist Dr. Sudhakar Selvaraj says COVID-19 has caused a collective trauma of pandemic proportions.
People have to change jobs, lose jobs, or relationship problems, domestic violence.
And prolonged anxiety can lead to depression in anyone.
The common symptoms are you feel sad for longer periods and most times of the day, more frequently.
Dr. Selvaraj says not everyone who is depressed is also suicidal, but it's important to know the warning signs, including when someone talks about death or suicide or expresses feelings of hopelessness, extreme mood swings, giving away possessions, and saying goodbye to family and friends. But the toughest situations to navigate are when people don't display any symptoms. Dr. Selvaraj says that's when listening becomes crucial.
Your family member or relative or a friend, if they are suffering, it's more important that you listen to them, not judgmental, and so that they can open and talk about it.
Dr. Selvaraj says once a person opens up, urge them to make an appointment with a medical professional, which in many cases takes patience and persistence. It also helps to be a public advocate for mental health help.
They use the social media and all the other resources in a positive way, not just spreading all the problem messages. It's more about sharing the helpline, the important things resources that you can share too. And that's the best thing a community can do at this point.
And this is a major resource. Please call the National Suicide Prevention Lifeline if you or someone needs help. That phone number is 1-800-273-TALK. And for more information on our series with UT Physicians, go to khou.com/wearthegown.